Right now in medical rounds for you, questions about the coronavirus just keep coming up over and over again as this new virus spreads across the country and around the world. You obviously have been asking so many questions, so right now we are trying to get you some answers. Joining us right now is Dr. Stephanie Wright, the Assistant Director of Infectious Disease with Hartford Healthcare. Dr. Wright, thank you very much for joining us.
Thank you for having us, and good evening.
Yeah, let me ask you, can you explain the pilot program Hartford Healthcare is rolling out right now where people, we understand, can get tested by staying inside their car? I've been reading about this kind of around the world.
Sure, yeah, this is mirrored other plans throughout the world where we're planning to have patients be able to drive up, or persons drive up who have symptoms, fever and cough, and have a healthcare personnel who is wearing the appropriate protective personal equipment, who will do swabs of the back of the throat and the nose to be sent for testing.
I'm assuming that would happen more so once we actually, folks have more access to the tests that they need, right?
Yes, that's right. Right now we're actively looking into which labs, private labs, will have the availability to do this testing.
Do you anticipate this dying out, you know, the way the flu typically does each year? You know, obviously as spring gets here, the flu dies off. I think a lot of people are hoping that this is going to peak at some point, obviously. Do you see that happening?
Well, there is some evidence to suggest that in China, there is a definite huge decrease in the number of cases. Whether this will be a situation where each spring it would die out and then come back late in the fall again, I think we don't know enough about this virus yet to know for sure the answer to that question.
You probably may have the same answer for this next question. If you get it once and recover, can you get it again? Do they know if that can happen right now?
Yeah, I don't think that they do know for sure. As of this time, what we have suggests that it might be possible for people to, once they get over the illness, to have immunity to it and be able to be, for example, able to care for patients who have active coronavirus. But I don't think all the information is in on that, unfortunately.
Okay, Dr. Wright, I have one more quick question for you. You know, are you nervous? Should people be nervous? Obviously, we keep telling people not to panic. Sometimes that's easier said than done, I think.
Sure. You know, I'm not nervous at all. I think the things to remember about this virus are that for the vast majority of people, 80% or even higher than that, that they're going to be able to recover from this illness at home and never even enter the hospital. What our planning is all aimed at for all the hospitals and healthcare systems in Connecticut is the small percentage of people who may get extremely ill, who tend to be older and or have underlying conditions, and we want to make sure we have the hospital resources both to care for those patients and to care for the other patients that we have in the hospital that need care, that are undergoing procedures we do every day in the hospital. And so this is why we're recommending the social distancing. This is why some schools have been closed down and so forth. But I think for all of us, if we remember the respiratory etiquette and the hand hygiene, we're going to do fine.
Okay. Dr. Stephanie Wright, we will leave it there. That's some good news. Thank you very much for joining us.
May I please give the number of the command center in case the public has questions, and that would be 860-972-8100, or you may text COVID, COVID, 19 31996. Thank you so much.
Okay, thank you. We will post all that right now on the Channel 3 app, and we will be right back. Dr.